Endovascular surgical procedures are minimally invasive techniques used to treat conditions affecting blood vessels. These procedures involve navigating small catheters or devices through blood vessels to the affected area. Here are some common endovascular surgical procedures. 1. Aneurysm repair. Endovascular aneurysm repair, EVR, for abdominal aortic aneurysms. Thoracic endovascular aortic repair, TEVAR, for thoracic aortic aneurysms. Cerebral aneurysm coiling, for brain aneurysms using detachable coils to block blood flow. 2. Angioplasty and stenting. Percutaneous transluminal angioplasty, PTA, balloon inflation to widen narrowed arteries. Stent placement, inserting a metal mesh to keep arteries open. Drug-eluting stent, DS, a stent coated with medication to prevent restenosis. 3. Thrombectomy and thrombolysis. Mechanical thrombectomy, removal of blood clots, often in stroke patients. Catheter-directed thrombolysis, administering clot-dissolving drugs directly at the clot site. NASH 4. Embolization procedures. Uterine artery embolization, UAE, treats fibroids by blocking blood flow. Prostate artery embolization, PAE, reduces symptoms of benign prostatic hyperplasia. Arteriovenous malformation, AVM, embolization, treats abnormal connections between arteries and veins. Tumor embolization, blocks blood supply to tumors. NAR 5, endovascular treatment of peripheral artery disease, atherectomy, removing plaque buildup in peripheral arteries. Cryoplasty, combines angioplasty with cold therapy to treat arteries. 6. Venous procedures, endovenous laser therapy, EVLT, for varicose veins. Radiofrequency ablation, RFA, another technique for treating varicose veins. Venous stenting, for conditions like deep vein thrombosis or chronic venous insufficiency. 7. Carotid artery procedures. Carotid artery stenting, CAS, prevents strokes by treating carotid artery stenosis. 8. Endovascular management of trauma. Endovascular bleeding control, for trauma-induced bleeding, e.g. pelvic fractures. Resuscitative endovascular balloon occlusion of the aorta, temporarily controls hemorrhage. 9. Endovascular treatment of aortic dissections. Stent grafting for type B aortic dissections, repairs tears in the aortic wall. 10. Dialysis access maintenance. Angioplasty of dialysis fistulae or grafts, keeps blood flow adequate for dialysis. Thrombectomy of fistulas, removes clots from dialysis access points. 11. Endovascular interventions for stroke, mechanical thrombectomy, to remove clots in acute ischemic stroke. Intra-arterial thrombolysis, administers clot-busting drugs directly to the site. These procedures are performed by interventional radiologists, vascular surgeons, or interventional cardiologists, depending on the condition and anatomical location.